everyone, happy afternoon, a very good afternoon. I hope and I believe all of you are doing well, especially the students who have given the INI-CET May 24 exam, which was conducted today itself. So let me know your first impression as well. How did you find the exam? Yes? I'm just going through your comments and understanding how did you find the paper? Right. So a lot of mixed review is what we are getting, and that's true for any exam that I generally take the review for. Yes. So yeah, I'll tell you my opinion as well on the exam. So how did I find the exam, and what is my opinion on that? And what is the learning lesson for the students, the next batch who's going to appear for the next INI-CET exam? What are the learning lessons from the exam over a period of time that we have had from all the exams that we have been conducted, the INI-CET exam, right? So yeah, let me tell you that the paper seemingly seemed to be easy, right? But actually there were a lot of trappers and the options were confusing. In many of the questions, we could rule out the two options easily, but then the remaining two options, which is our most common and the most important dilemma, was always there, right? So for example, if the question that you have, which is which drug is a HER1 inhibitor, which monoclonal antibody is HER1 inhibitor? What do you think was the answer to that? Thank you so much, Ankit, for that. I'll come to all of that. How was the subject's weightage, the topic's weightage? Do we have any common inference from all the INI-CET exams? What are their favorite topics that they ask very frequently? Right. So, I can see in the live chat also, many of you are saying trastuzumab, pertuzumab. Guys, so this was actually a trapper, an example of a question which looks very, very easy. But remember, the question was asking about HER1. Okay, the question was asking about HER1 and not HER2. Trastuzumab, that is HER2. HER1 is actually EGFR. Okay, HER1 actually is EGFR, and I'm sure that if the question would have been EGFR monoclonal antibody, inhibiting antibody, then you would have definitely known the answer, that is cetuximab. Okay, that is cetuximab, which is used in head and neck cancer. Right, so that is what was the trapper there. They did not ask you HER2, right? The INI-CET examiners know that, the students also know that we ask HER2 so common. Once we ask trastuzumab, then we ask instead of that lapatinib, and now let's trap the students and now put the HER1, right? So remember that it is basically, the answer should have been cetuximab. This is just one example of a question I'm giving you, which seemed very easy. There are going to be many more questions when you will realize from the recall key, oh, so this is where I got trapped. The learning lesson here is, do not sink down into the depression. How could I make this silly mistake? Why did I make that mistake? But take it as a learning lesson. Okay, take it as a learning lesson. So overall, if you ask me, the paper level was average. It was not like very easy and not very, very difficult. A student who has had very, very good MCQ solving skills, who knows how to logically guess the answer, rule out the options, who can read the questions fast, for them the paper would have been easy, right? So that is what the learning lesson is. Okay, that is what the learning lesson is. Okay, right? Don't worry, Sayantan, that happens with everybody. See, you have a margin of making a lot of questions wrong, right? So do not worry on that front. If you get one question wrong, oh my god, I did not mark cetuximab here, that does not mean that your paper was not good. So it's not that all the questions, answers that you have marked are going to be correct. So all the recall sessions that we are going to have, in this session I'm going to discuss the first impression analysis of INI-CET exam, and then at 4 p.m. we'll meet again to discuss the radiology recall questions as well. Okay. Coming to the the length of the paper. Was the paper lengthy or not lengthy? Personally, I felt yes, it was a bit lengthy paper, in the sense that it was not that the time was very short, But yes, like I said, the 2 options for remaining, you need to think over that. And especially, when you have that block-wise exam. So initially, for the first 10-15 questions in every block, you take some time to get the speed, to get the pace, and then it goes good. So the lengthy questions, actually the trick which I always tell you, read the last 2 lines first, helped many questions to save the time, right? So someone who has used all the cheat codes definitely is going to good, definitely is going to fare good there. I'm coming to the errors also, Srinivas. I'll tell you what the error was also there. Okay? Next one, yes. There were quite a few questions on match the column, assertion reasoning pattern, and multiple options correct. Match the column type of questions are the ones which are actually your scoring questions, because you can easily rule out the options there, right? It helps you rule out the options. The best part here is you don't have to do match the column for every option which is given. So when it is given 1, 2, 3, 4 and A, B, C, D, if it would have been the pattern like where you have to choose out of the 4, 1 is what, 2 is what, it would have been difficult. Here it becomes easy because you have 4 options which gives you the combination. 1 is A, 2 is C, right? So you can easily rule out the options. So these are the type of questions which were actually the good and the easy questions. Right, example, the dermatologic question which was there on contact dermatitis, patch test is done, tinea cruris, KOH test is done, right? For leprosy, split skin smear is used, for tuberculosis, biopsy is used, all of that. So even if you know one of that, the trick that you can use here and score more is basically, I know that patch test is contact dermatitis, so I look for the option which says that 1 is D. So out of 4 options, if 2 options say 1 is D, I rule out the rest of the 2 options. So that is how match the column questions were actually the easy and the scoring ones. There were 3 to 4 assertion reasoning type of questions that were there. So for example, the question on Corynebacterium diphtheria, it causes myocarditis, but then there was a reason why it causes myocarditis. There was a question on malaria, Plasmodium falciparum, why do you not see the schizo stage, right? So there were 3 to 4 questions which had assertion reasoning. TB का एक था, N-acetyl cysteine use करते हैं, NOH use करते हैं sputum sample के लिए, and the reason was there. So assertion reasoning were a bit, I personally thought was a bit confusing ones, is what I think. Okay, and the next one that we have is multiple options correct. These were again a bit of a confusing ones. Few questions were straightforward where you could rule out, but few questions were confusing ones, right? Coming to, were there a lot of PYQs in the exam? Not really, right? The questions per se were not repeated, but yes, the paper was again PYT predominant. You cannot say that there was any topic which was like very eccentric out of the syllabus, just that on the PYTs, the depth of the topics was asked, definitely they went into the depth of the topics, right? So PYQs not really, but PYT yes. There were some eccentric questions in pharmacology, like asking the question in depth about voriconazole, right? Voriconazole, what is true, what is not true for voriconazole, whether it needs loading dose, therapeutic drug monitoring, empty stomach pe lena padta hai, right? So that was, then you had the question on which of the following are suicide inhibitors. So not everybody knows that list, right? So few questions eccentric in pharmacology is always INI-CET favorite, right? But thankfully there were no questions on new drugs, a lot of questions on new drugs, but yes, the questions were a bit eccentric. The new topics per se were not so much in this INI-CET is personally what I felt. Same topics, we did have multiple questions on one topic. So for example, 2 questions were there on some dehydration, right? Both the questions mentioned there is increased thirst when there is some dehydration, right? There is no lethargy in some dehydration. Like there were 2 questions on some dehydration, 2 questions on fracture neck femur in elderly patient. Quite a few questions, 3 drugs, 4 drugs, 4 questions on diabetes mellitus drugs, very important. And again, there were 2 questions on acid-base disorders as well. So on few topics, you did have multiple questions, and यहाँ पे तो 2 questions were repeated, like almost the same. Okay. Then we had subjects weightage. So the pre and the paraclinical subjects had a lot of questions. For example, anatomy was predominant, I felt, and PSM, significantly less questions as what we routinely see is what we observed. PSM may say no questions on, a lot of questions on, no questions on epidemiology, health programs, screening, biostats, a lot of it that we expect surprisingly was not there. Okay, surprisingly was not there. Okay, and the next one, surprisingly, we did see a lot of questions in radiology, and the radiology images per se were not like straightforward images. They were a bit difficult and tricky images to interpret, right? They were not like straightforward. Like the question on what anatomical variant do you see in the CT chest? What did you mark that as? Yes, absolutely right, Bhag. That is what I would agree to. So that's what I said. To get a good rank in the INI-CET exam, what we have realized is it's not just the reading the theory, getting the knowledge. It is also more important to learn the tricks, the cheat codes, the MCQ solving skills, all the mnemonics and the tricks, which basically save a lot of time in your exam hall. They really help. Right, it's not just theory and the notes. Practicing questions from the Qbank is equally important, guys. So do practice a lot of questions from the Qbank. They help you. Was it tracheal diverticulum? So I'll be discussing that with the image in the radiology recall. So Vibin, you are right. The answer to that actually was ARSA, the aberrant right subclavian artery. Okay? So it was aberrant right subclavian artery only that you were seeing. It was neither your double esophagus or a tracheal diverticulum or the right sided aortic arch. It was aberrant right subclavian artery. So if you can recall the image, I'll show you the image again in radiology recall session. There was one artery which was in front of the vertebra, and you could see 3 arteries separately which were coming from the arch of aorta. So there were totally 4. So that was aberrant right subclavian artery. Okay. Yes. So Shashank, this is more of testing. Like I said, the paper definitely tested a lot of logical thinking. That is what I felt. This INI-CET exam was a lot of tests about logical thinking, logical guessing, and MCQ skills. It was lot of that. Okay, it was lot of that. Hannah? Yes. Next one, what was T10 for? No, that one image that we had, which was the X-ray knee wala image, it was patella fracture. There was if you look at the image very carefully, there was one lucent line going through the patella, femur co-overlapping, right? It was neither your heme arthrosis, hemophilia wala heme arthrosis nahi tha, rheumatoid arthritis nahi tha, tibial condyle fracture nahi tha, patella fracture tha. Okay, it was patella fracture. Yes. Right. And someone was saying Mount Fuji sign. Remember, the Mount Fuji sign is tension pneumocephalus. Okay, that is seen in tension pneumocephalus. And you have USD contrast that can be given in renal failure. CT may, the HU value is 0 for water. Right, achalasia image was there. Then pericardial effusion pointing towards was also the X-ray was there. Okay. Yes. Some topics, coming to the topics which had a very high weightage in the today's INI-CET exam. A lot of questions related to blood transfusion, right? So many questions related to blood transfusion. So what disease can be transmitted by all the components? Then you had a delayed hemolytic reaction post transfusion, right? And the storage shelf life of the various components that was there. Some dehydration. Neuroanatomy, always we have seen, so a learning lesson for the future exams. Please remember that neuroanatomy is very important for INI-CET, considering that NIMHANS is participating in INI-CET. So neuroanatomy questions were also there. A few, one, two questions I felt were a bit eccentric, but yes, A few questions were very logical as well. Okay, they were very logical to interpret the cadaveric images as well. Okay. Shiv Pratap, of Thal per se, I would not say there were a lot of Ajib questions. Again, there were the keywords in the questions to help you answer the questions. There were easy questions like third nerve palsy, superior oblique action. These were straightforward questions that we had, right? Then you had a trap or a keyword like flashes of light. So we'll discuss that later on. So like I said, someone who knows how to catch the keywords in the question will definitely score very good in the today's INI-CET exam. Yeah, there were no biostats question, no numericals, be it ever from physiology, pharmacology, PSM, कहीं से भी कोई numerical नहीं था. There was no numerical question. Tamanna, that X-ray image, a patient of trauma where you were given supine X-ray, that was hemothorax. Okay, that was hemothorax. And this, I'll discuss it in detail in radiology recall. Yeah. So there was decreased weightage for OBGY, there was decreased weightage for PSM as well as surgery is what I would say. Rather the question was a lot, a lot of the paper was dependent on the basic knowledge of the first year and the second year subjects. Again, molecular biology, we did have 3 to 4 questions like fish cannot detect, there was question on post-transcriptional modification. Then you had the neonate metabolic disorder screening ke liye. And there was one question on the suppressor mutation. So there were 3 to 4 questions related to the molecular biology. Yes. Were there a lot of image based questions? Yes, there were quite a few image based questions which were there, but they were not like very, very difficult. Except for radiology few questions, the rest of the images were good enough. Like the Lineweaver-Burke plot. Right, if you guys know the mnemonic, C for crossing competitive and V is the non-competitive. So we had that image based question and quite a few other image based questions which were there. Now 2 questions are there which actually can be reported for the error being there, and those 2 questions are one was match the column question which was based on the various lymphoma like H. pylori, gastric malt lymphoma, Borrelia burgdorferi, skin wala tha. Right, there was this one question which was there. So this was basically the error which was there. The options which were labeled here was 1, 2, 2 and 4. So instead of 3 here, it was 2 written here, and for a student who would have not paid attention to this would have marked the wrong answer, right? So that's actually a typing error in that question. Okay, that's actually the typing error in that question. Another error was a question on GERD where 2 options were same. The question on extra esophageal manifestations of GERD, which said that laryngitis, asthma, pulmonary fibrosis and excessive phlegma which can be produced. So these had, these had 2 options correct which said that 1 and 4 are correct. Okay, so 2 options were same in this question, the GERD. So these 2 questions actually should be reported and they should be taken into consideration for all the students. So each one of you should be doing that, basically report these 2 questions. If you want to get 2 extra questions right, we should be doing that. Okay, yes. ऑप्शंस भी रॉन्ग थे, एब्सोल्युटली राइट, क्योंकि 2 ऑप्शंस उन्होंने सेम कर दिए थे तो उसमें ऑप्शंस भी गलत हो गए थे. Right, yes, there were a lot of questions related to cardiology. ECG question was there, right? A lot of questions on endocrinology. Okay, a lot of questions on endocrinology was there, like Cushing's ka clinical features was given, hypercortisolemia, easy bruising, all that was given. Next what we had was the image based question, growth hormone wala, and I think this was the straightforward question which looked very difficult. If you would have used the cheat code again, ruling out the options, there was only one option which actually told that this was the hypothalamus, A and B was given, and you had the pituitary. So A was inhibiting, B was stimulating, and then this was going to the liver, IGF was given. So all the options mention that this D is actually the IGF. So all the options mention that. There was only one option which said that A is somatostatin, right? The term itself tells you somatostatin is static to the somato, the growth hormone static. So there was only one option there, and that's what I said that basically getting your the tricks, the MCQ solving skills right is very important. Okay, that is very important. You could easily get the answer right, even though this seemed like a difficult question. Actually it was easy. Okay, actually it was easy, right? Fetus में growth कौन नहीं करवाता है मुस्कान? That's a previously asked question. I think it's a direct repeat question. The growth hormone per se does not contribute to the fetal growth. It is insulin-like growth factor, thyroxine, insulin. Growth hormone by itself does not contribute. Yes, right. So those were few learning lessons from the INI-CET exam, guys. No matter however was the paper, okay, no matter however the paper went, if it went good as you expected, well and good, right, and for those who feel that मेरा paper जैसे मैंने expect किया था वैसे नहीं गया, so please do not fret over it a lot. The best part is you have NEET PG in next 1 month, and the INI-CET has been a really good mock test for you with the real exam conditions, where you have practiced the block wise paper as well, and now you know how to improve on that. You've got the realization what subjects, what topics I'm lacking, what mistakes I make in the exam hall, whether I could manage the time, whether I was overthinking, whether I was getting panicked, all of that. So take the learning lessons out of it and prepare well for the upcoming NEET PG exam. You still have time and you can turn the tables over, right? So yes, the learning lesson, I would say the bottom line for the today's INI-CET exam is someone who's very good with logical thinking and logical guessing, whose concepts and basics are very good, would have done well in the today's exam. So remember that to crack these exams, you do need to get your basic foundation right. Majority of the students who fear the first year and the second year subjects, remember they are very important and they help you answer even the clinical questions. They form the major chunk of the exam, especially in the INI-CET exam, right? More than the the variety of the topics were the same, just that the options were in depth, the topics were asked in bit depth, right? So that's always been the case for INI-CET. So remember that if you want to crack INI-CET for the next batch I'm talking about, is you need to go into the depth of the topics rather than the breadth of the topics, right? So yes, Dr. Gufidu, how can you mark unstable angina just on the ECG? Whether it is unstable angina or it is NSTEMI, both of them will show ST depression. The only thing is cardiac enzymes will be difficult. So I think it was posterior wall MI where you had the ST depression, which is the reciprocal changes seen in the anterior leads. So that would have been the posterior wall MI, right? That would have been the posterior wall MI. Ankush and everybody else who feels that I'm broken and can I still crack NEET, guys, you actually can. Do smart work. Practice more questions from the Qbank. How do you rule out the options? How do you logically guess the answers? That's I think is of utmost importance to crack these exams. Very important. Yes, Priyanka, that was a bullet wound. How to approach how to approach for NEET PG now? So again, even in NEET PG, remember the previous year questions will not be repeated as it is, but the previous year topics would be. So what you should be doing is start with the PYQs, provided of course and assuming and hoping that you have finished with at least one read for everyone here. So start with the PYQs, whatever topics are there asked, go into the depth of those topics. Okay, that is how you should actually be approaching preparing for these exams. That's very important. Ajay Kedar, that was again I would say an easy question. The upper segment lower segment ratio जो दिया हुआ था, which was 0.821. So the upper segment was less as compared to the lower segment. Whenever the upper segment is less, so you are thinking of the spine ka something related to spine, that is spondyloepiphyseal dysplasia. Mount Fuji is pneumocephalus. That CT image was chronic osteomyelitis. Okay, where the bone was dense and irregular bone, that was chronic osteomyelitis. डॉक्टर ने नीट में इतनी डेप्थ में नहीं पूछते हैं कंपैरेटिवली एज INI-CET. नीट डज नॉट आस्क सो मच इन डेप्थ, बट यस द PYTs of course remain important for the NEET as well. For mental health gap action wala question, the answer is OCD. OCD is not included. Kawaljeet, we have already discussed, it is cetuximab. अपर सेगमेंट कम था, अपर सेगमेंट कम था. नी रेडियोग्राफ और पटेला फ्रैक्चर. ओके, राइट. See, the learning lesson beat for FMG or beat for NEET PG from this exam or beat any exam remains the same. Guys, please do not do this mistake. So I would basically try to tell you on what are the mistakes that you should not be doing in your coming 1 month, be it for your NEET PG or be it for your FMG exam. All theory, no MCQs practice, no MCQ practice is never going to give you a good rank, right? So you have to now start retrospective. If you have not done that, majority of the day you should be doing MCQ practice. Write down the questions which you make wrong, the topic basically, and revise that once you have done. So let's say do it in the set of maybe now you have 40 questions or 50 questions ka set in your NEET PG FMG exam. So do it, solve the questions in a set of 40-50. So you will be getting the practice of the exam also in the block wise, and side by side when you are reviewing, write down the topics that you made mistake in and revise it from your main videos or the rapid revision videos from PrepLadder, right? So revise it from the videos and do make the concise notes of that topic, because every time going back to the videos might be difficult, finding that topic might be difficult. So start jotting down, scribbling down your notes, very, very important. Second, you need not know all the answers to all the questions to get a good rank. You can actually get more questions right by using the cheat codes, like I say, by using the tricks and the tactics of ruling out the options, logically guessing the answer. These exams do test a lot of this logical thinking. They do test a lot of it. Third very important lesson that we have learned is PYQs, not just PYQs, more than that, the PYTs are very, very important. You cannot afford to make a mistake in a previously asked topic wala question, because that is the question that majority students will do right. If you make that wrong, your rank is going to get affected significantly. So these are the top 3 lessons and the mistakes that I don't want you to do while you are basically preparing for your upcoming NEET PG or the FMG exam. Preetham, the 4 sets that we had were not really like subject wise, though it was predominant, like majority of ophthalmology ENT was in one section, but I believe that for everybody it is different, right? The questions sequence is different for everybody, but yes, like first year, second year subjects थोड़े साथ में clubbed है, short subjects थोड़े साथ में clubbed है, ophthalmology ENT साथ में clubbed है, but at the end remember it does not really matter, because for us it is scoring out of all the 200 questions, which is important. है ना? Rib was posterior, right? The chest x-ray showing the marked area was the posterior rib. That was the posterior rib. Yes. So that were few learning points, correct, Arpit. See, these are all logical questions, I believe. Someone who's asking the question like connective tissue degradation के बाद जो aneurysm हो रहा है, logically thinking, I personally believe should be, I mean, this is the logical thinking that I would have had, कि atherosclerosis causes the degradation, and that is how the wall becomes weak, and that is what leads to aneurysm. The rest of them were basically your genetic defects which were there. There is no degradation per se which is happening. नहीं, it was posterior end only. Okay, that was posterior end. है ना? Oblique नहीं था, वो horizontal. It was marking to the horizontal end. Right, so it was the posterior end of the rib. Correct. So these are the learning lessons for those who joined late. A reminder that there are 2 questions which had an error. So if majority of you report and let the examiners know, maybe all of you will be granted the marks for these 2 questions. So one match the column of lymphoma wala और एक GERD वाला जिसमें 2 options same थे. Right. So you can take a note of that as well. ठीक है. So the respective questions will be discussed in detail with the recall sessions. I'm not going into the detail of the questions. This was a quick overview and a learning lesson for everyone, and to tell you that no matter how you have done in your exam, remember it was just one exam and nothing more than that. It does not decide you as a person, your caliber as a doctor, your potential as a clinician, or nothing else, right? So at the end, it is just one exam. Remember that. If you have fared well, well and good, congratulations. If not, you are not going to waste your time. You are going to bounce back and you are going to prepare well for the NEET PG exam, because remember that now every day will be important for your NEET PG exam. So if you have not fared well, if the exam did not go as expected, please do not waste your time. You cannot go back and change the answers of the INI-CET exam. So if you do that, keep crying over it, definitely you will not crack the NEET PG exam. But if you bounce back and you tell yourself, I'll just forget this for the time being, get your suppression into place, right, the defense mechanism suppression into place, and tell yourself, I don't remember anything of what has happened. What I'm focusing is just on the upcoming NEET PG exam. You cannot afford to waste even one day. Relax and take a break for today. But if you think that I need to buck up for NEET PG, I would strongly suggest do it from tomorrow itself, right? We can do all the rest, I believe, once the NEET PG is done. So please do that. Okay, that is, don't worry on how the exam was. It's absolutely fine. And sometimes, you know, till the results come, you never know how actually you did in the exam, because it's a lot of comparative, like, you know, where you have, it's a percentile based exam where your performance is based on how well or how bad the other students have fared. So you don't know how everybody else has done. So you don't know what rank you will get per se, right? So do not overthink till the results are out, but at the same time, do not waste your time also for the upcoming NEET PG exam. Okay. So yes. So guys, that was about the quick review, the first impression. I'll see you again at 4 p.m. For the radiology recall questions. There were 10 to 11 questions, right, which were integrated radiology questions, and few questions which were straightforward from radiology. So definitely there were more questions in radiology this time, and tricky questions as well. So I'll discuss about that at 4 p.m. in detail. Till then, you guys can take a rest, and I'll see you again at 4. Till then, goodbye, take care, and do take a rest for today. But then after that, keep studying, keep revising, and keep winning. Thank you so much.